Hi, I'm Dr. Kharrazian, and I want to talk to you about the three most common symptoms that are actually Hashimoto's hypothyroidism but get completely overlooked in the healthcare system. And the first one is chronic major depressive disorder. So when patients have chronic depression, one of the key things that we know is you have to rule out Hashimoto's. So hypothyroidism and Hashimoto's, where it's just this autoimmune pathophysiology of hypothyroidism, can really lead to chronic pathophysiological mechanisms that lead to depression. So first of all, when there is lack of thyroid hormones or inefficient thyroid hormone production throughout the day, there is a dramatic impact on serotonergic pathways, dopaminergic pathways, cholinergic pathways, and catecholamine pathways. These have a tremendous impact on mood and motivation and sense of well-being. So we know that the fluctuations of thyroid hormones that take place with the autoimmune response of Hashimoto's can really cause major depressive disorders. The other key thing is that when people have Hashimoto's, the inflammatory cascade from the autoimmune response can really slow down nerve conduction. This can also play a significant role in major depression. So one of the key takeaways I hope you get from this video is that if you ever have a patient come in that has chronic major depression that no one has helped, you may need to really look at their thyroid, but even more specifically, you may need to look at their antibodies. Some patients that have Hashimoto's, and when I say antibodies, I mean TPO and thyroglobulin antibodies, but some patients that have Hashimoto's, you may not find the condition until you really specifically evaluate to see if there's any elevations of TPO or thyroglobulin antibodies. So that's one key thing. Another major common chief complaint in the healthcare system that may actually be Hashimoto's is infertility. So one of the things that happens when people are suffering from hypothyroidism associated with Hashimoto's is they get, again, these fluctuations of normal and abnormal thyroid hormones, and these things start to throw off the pituitary ovarian feedback loop, and ovaries lose their responsiveness to FSH. You get the corpus luteum that stops responding to LH, and things like the release of a follicle or the maturity of the follicle get significantly impacted, and then you have many women that really suffer from chronic infertility because of underlying Hashimoto's hypothyroidism. So it is pretty routine to check for hypothyroidism with any patient who has chronic infertility. However, you may need to go a step further and check TPO and thyroglobulin antibodies also in combination with just evaluating hypothyroidism by measuring TSH. So the third most common cause or chief complaint that comes into the office that may actually be Hashimoto's that's typically overlooked is chronic constipation. And one of the things that we know is that when people have Hashimoto's hypothyroidism, once again, those surges of thyroid hormones going up and down, and the inflammatory autoimmune cascade can really impact gastrointestinal motility. Gastrointestinal motility is the ability for the vagal motor nuclei to activate motor complexes in the gut. The inflammatory cascade in combination with lack of thyroid hormones can lead to chronic constipation. So the takeaway message is, if you ever see a patient coming in that has seen numerous practitioners, they've had everything checked, they've had everything done, and they come in with either major depression, infertility, constipation, not only should you, as a clinician, evaluate for any kind of hypothyroid issues, but you should go a little bit further and just check to see if they have any TPO thyroglobulin antibodies, because those levels can then change their TSH levels at different times throughout the month, and it can be missed unless you check those markers as well. Anyways, we're going to go over all these key concepts related to Hashimoto's in the Kharrazian Institute, clinical strategies and treatment applications for Hashimoto's, and hope you can attend that course. Thank you for your time.